Steinberg. I am your mayor, and I welcome you to another edition of our Facebook Live. In a moment, I want to introduce my special guest, Chet Hewitt, but I want to start with just a couple of beginning remarks here. The governor of California, Gavin Newsom, made a very important announcement today, as you all know. Basically, what he said was that beginning Friday, if any respective county within our state has met the test, namely the protocols that are necessary to open a wide variety of industries, from retail to manufacturing to childcare, even restaurants, even movie theaters, that if we can demonstrate that we have enough testing, that we have enough personal protective equipment, and that we have the protocols to ensure that the physical distancing continues, even when a restaurant or a movie theater or a retail establishment opens, that he will give permission for us to open again as early as Friday. The governor also said that this Thursday, he would announce more specific guidelines to help guide our counties. And so your city of Sacramento, of course, is in close connection and close consultation with our county partners. And I know that they are working hard, and we are supporting them to get everything in place so that in Sacramento County, we can open more sooner rather than later. Our success in the end, in the short term and over time, will depend on us continuing to do what gave us the distinction of having the fewest infections per capita in the entire country as a region. And that is to vigilantly continue our regimen of physical distancing. And I want to just add one other thing before I bring Chet on. The mask issue has been voluntary in Sacramento County, and I understand that. But as we transition and as we open back up, it is going to be even more important for us when we are out in public to have that extra layer of protection, not just for ourselves, but for each other, and wear masks. And I am going to call on our county health officers to change that order, the mask issue, from voluntary to mandatory, and to time that mandatory requirement for when we actually begin opening up more broadly. If that's Friday, if that's Monday, if that's next week, I believe that a mandatory mask requirement ought to accompany that opening up, because it will allow us to open up faster. And maybe more importantly, it will allow us to continue to be open and to not have that spike, which we are also fearful of, which we have thus far successfully avoided. Because the worst scenario would be to open up in a way that was not fully cognizant of the continued risk, and then to see a spike, a hospital surge, more people getting sick, more people dying, only to have a stay-at-home order reimposed in an even stricter fashion and for a longer period of time. More on that tomorrow in the days ahead. But I thought today overall was a very hopeful announcement by the governor. And as he said, we are just days away, not weeks away, from being able to, in a safe way, help those who are hurting economically and to begin to return to a semblance of community life. That is my opening remark. And now, if we could please bring in a very dear friend of mine, someone who I have great regard and respect for, and someone who I consider a great community leader, and that is Chet Hewitt, the CEO of the Sierra Health Foundation. Chet, welcome to you.
Good evening, Mr. Mayor. Honored to be here and be part of this conversation this evening.
Absolutely. So you are well known in Sacramento, but there are people who are watching this tonight who do not know you. So tell us a little bit about Chet Hewitt and the Sierra Health Foundation.
Well, the Chet Hewitt story, I can be brief on that one. I know it pretty well, but a long-time advocate for families and children, have had what I consider to be the privilege, a real privilege of having an extraordinary career, starting as a community organizing, law school, working on criminal justice reform in San Francisco in the Bay Area. A trip back to some national foundations back east that are pretty well known. And then what I consider one of the hallmarks of my career before coming to Sierra Health Foundation, which was serving as the Director for Social Services for Alameda County for years as well. So I've been in philanthropy, been in communities, and have spent some time in the public sector over the 30 plus years I've been involved in the battle to improve the lives and livelihoods, life chances of children and families.
And the Sierra Health Foundation.
Sierra Health Foundation was in many respects my dream job come true. I had kids late in life, so I was raising my kids, really wanted to be at home a lot so I could coach basketball and football and do things with my two wonderful sons, one who's 15 and the other who's 12, and to spend more time with my wife after doing a lot of policy work across the country. And lo and behold, was selected and appointed to be the president of the Sierra Health Foundation. 5 years later, opened up the Center at Sierra Health. We are a health conversion foundation. There's many of them around the country now. That means that something got bought by a for-profit firm, created the foundation. And we're unique in that we have long focused on the social determinants of health. Now, we know that access to high quality clinical care is important. That's really great and necessary when you're ill, but we have focused most of our investments on trying to promote health and well-being so you can tamp down the instances of illness in communities that we do have the opportunity to control. We invested in communities that are on that are often forgotten or underinvested in as part of our strategy for improving the overall health in California.
And you've been a pioneer in efforts like the Black Child Legacy Project. You've been a key partner in our effort to establish an inclusive economic development agenda backed by the sales tax revenue for Measure U. I want to ask you, pre-COVID-19, to assess the strengths and weaknesses of Sacramento's diverse neighborhoods. How do you see Sacramento?
Well, Sacramento is a great city, and it is a city that is emerging and becoming an even greater city in the future. It's well positioned and well poised to take and make those steps. But like many urban centers, there are communities that have been underinvested in and who have not come along as quickly on that emergent journey as other communities have. And so, I think that what's really fantastic about Sacramento, given its political leadership, starting with yourself, Mr. Mayor, is that we have a tremendous opportunity to show how cities of the future can incorporate those underinvested communities into the kind of larger economic plan that it has for the prosperity of the people who live in the city and in the region. And I think that has been, a hallmark of the foundation and center's relationship with the city, to try to figure out how to do it, not just to say that, but how to get that done.
And how to do it. And when you think about the needs of our diverse Sacramento neighborhoods, especially those that have been traditionally disadvantaged, what categories arise for you in terms of the types of investment that our neighborhoods need?
Well, if you're an emerging city, that means you have emergent opportunity, new industries, new sectors, taking root and prospering. I think you have to be able to train your workforce to participate in those new sectors as well. So employment as part of that economic development model, I think, is really, really important. You have to invest in creating the kind of older business corridors that folks who come to your city as tourists or who live in more affluent parts of the city can actually go to experience what diversity actually looks like. And from music to food to just cultural celebrations. How do you do that and create spaces that are both pleasing and safe and really expressive of the cultural realities that diversity brings to the city as well. As you know well, people travel to great cities to experience that level of diversity. But it has to be presented in a way that allows folks who are the architects of those activities to be fully invested in, to have the restaurants and the streetscape and the public protection and all the other things that go along with making any neighborhood a viable, safe, great place to be, to live, or to visit.
And talk about young people and the kids that are your kids' peers from all over the city in terms of how you define inclusive economic development as it applies to them. Where does it start, and where do we have to do better?
Well, I as a longtime youth development kind of activist, less direct these days, but my heart is still very much in that place. I remain amazed by the creativity, the resilience, and the grittiness of our children to actually help set new pathways, blaze new trails for where the city can go, and really support all the efforts that have been made and continue to include them in that particular process. We've done things like the pop-ups where young people have organized themselves on Friday and Saturday evenings to be able to, give kids safe, exciting, interesting places to actually gather. Those activities in partnership with community activists and law enforcement have resulted in the fact that in the city of Sacramento, we've had no underage 18 deaths in almost 2 years. And I can tell you, as I travel the country, I was in Milwaukee earlier this year with the King's organization, who's been part of that, talking about the work we've done. When I just said that, there was an audible gasp in the audience in a positive way. And I can tell you, at the end of that particular session, I was surrounded by people who wanted to know how a city could actually, make that happen. And to reward young people, since they've demonstrated the creativity that they could bring to whatever endeavor we're engaged in, we have got to invest in them as well. So beyond pop-ups, our economic mobility program, real training opportunities for them to be part of those emerging sectors. We've got to invest in broadband. There's no reason why some kids in some communities can't get access to the internet and technology in a way that other kids can actually do so as well. And in the arts and cultural spaces, who better positioned to create a vibrant city than young people expressing themselves in safe and interesting ways as well. So I think the idea of focusing on young people and giving them the tools, the adult allies to help guide them those processes, and even thinking about them as future entrepreneurs, because it isn't just about training them to work in sectors that are emerging, but to be the business and civic leaders of the future.
Thank you. I share your vision 100%, 110%, they say. Let's move to the last 6 weeks here for a moment, because it's been reported throughout the nation that COVID-19 has illuminated and exacerbated some of the existing inequities that already are apparent in our society. I want you to talk a little bit about what you have seen in Sacramento, in its neighborhoods, over the last 6 weeks, as our city, like the state and the country and the world, have responded to this unprecedented set of circumstances, and maybe take it in two parts. What incredible difficulties and challenges you have seen among small minority-owned businesses or neighborhoods, but also some of the extraordinary work that you have seen, especially among people who have little but are choosing to help their neighbors.
No, it's a great question, and I'll say that in many respects, and I don't think Sacramento is is, an outlier in some negative way in this. It really is a tale of two cities. I, as a co-founder, along with the city, by yourself and Councilman Jay Chenier, we started Donate for Sacramento. We've raised a fair amount of resources in that 6 weeks. We've deployed them in ways that I think this city can be quite proud of. About half of the $1.2 million we raised were actually raised by small donations from the average Sacramentan making a contribution out of their own pocket to do something great for people they might never know, business owners they might never meet, and children they might ever see. And I think that was an incredible undertaking and a true partnership with a host of folks, including some of our corporate leaders here in the region as well. And we've done some incredible things. We've invested over $160,000 in small grants to businesses in some of those aging business corridors. Over 500 families have received some kind of cash assistance to keep the lights on, help pay the rent, and things that you really do need cash going forward. We've brought enough food through the food bank, and Blake Young and his folks have been tremendous partners in this, to feed 2,000 families for 8 weeks. And so, we've seen Sacramento really step forward during this time to help some of its neediest citizens, those who can't quickly stock their cupboards or who have, accounts they can draw from if they were to get laid off to have their family, continue to have, all they actually need. And so really heartened, really proud of the Sacramentans who have participated in that effort. At the same time, this Saturday, I was down in Southside Christian Center doing some of the food delivery. And me and my son, Chet, loaded up all the delivery vehicles who showed up. Pretty well-oiled operation, showing the power of our nonprofits and what they can do, who were delivering food to seniors and those who were disabled who could not get in the car and show up for the distribution done by car to maintain social distancing through the parking lot. And after we finished, we then started loading up some cars. And one of the saddest things I experienced that day, it was a great day to be out with my son, working with some of the volunteers and communities, folks who had showed up just to be helpful, was that we got to the last food baskets and we still had additional cars. Cars we had to turn away because there wasn't enough that day to meet their particular needs. And in putting some of the food baskets into the car, a box of food for 5 people for 4 days, people offered me what little money they had. They said, thank you, just thank the people. You don't know what this actually means to me. It was an emotional experience like very few I have actually had, and I've been doing this work for a long time. When I seen that long line of cars when I arrived at 7:50 in the morning and left there about 10 o'clock when we ran out of food, I really felt like we were doing something extraordinarily important that was really needed by a community, and yet there was still a lot more that needs to be done.
Thank you. It's the level of distress out there is unprecedented, and we both know that this kind of a crisis, while it brings out the best in people, it also exacerbates some of those significant equity questions that you've been working on, that I've been working on, that the city has been working on now for some time. And it leads to really the next area that I want to talk about here, which is our work together and your work with the city on this broader inclusive economic development agenda. In 2018, as you remember, because you were involved, we put a sales tax measure on the ballot. It was a general tax, not a specific tax, for complicated legal reasons, but we passed it with 58%. We couldn't specify that the money be spent on anything in particular, but as the mayor, I promised that we would move as much of that money as possible towards our neighborhoods, towards workforce, towards affordable housing, and all of the other key elements of building up a community and neighborhoods. And we're starting, and actually started, I think, pretty impressively. And now COVID-19 has hit. And a lot of that money, at least temporarily, is drying up and having to be used to ensure that our city budget does not result in massive layoffs and dramatic cuts in essential city services. And one hand taketh away, and the other hand giveth. And now we have this federal stimulus money, the $89 million. And I'd like to have a conversation with you, a public conversation here with you about how you believe that the mayor and the city council and the city management and the community ought to look at this opportunity. And I want to break it down for you a little bit. You just talked about people who are hungry, and obviously small businesses, we know, are having a very difficult time surviving, and people who can't pay their rent or are going to owe a lot of back rent, even if they're not evicted now, they're not paying their rent. What should be the balance between using that money to respond to the immediate need versus investing in anything that might be considered foundational to build a more robust and inclusive economy over time? Workforce development, for example, doesn't necessarily put food on the kitchen table overnight, but it leads to somebody being able to support themselves and their family. What should that balance be between immediate need and investing in a longer term inclusive economy?
You know, I have long thought that the balance or the relationship between those two dimensions of what I would call a healthy society, you know, care for those who are less fortunate. And I'm not talking about charity, I'm talking about it within a developmental context. And the idea of a robust and vibrant economic sector need to be closely interwoven, I think, as we plan the future. And I think that's what led us to support Measure U, because Measure U was about inclusive economic development with a mind towards improving the lives and livelihoods of those who had been left behind. And so I think, you know, under your leadership, we have long thought about connection. And here's where innovation and disrupting old norms that, you know, were good perhaps in years past, but need to be different going forward, I really thought had a real opportunity to take hold in the city. And I don't believe that that opportunity is gone. I think, you know, the pandemic has kind of influenced what we're capable of doing, like the city's budget and others, but it shouldn't reshape our values. It shouldn't reshape our morals, and it shouldn't in any way deter our commitment to seeing that future that we articulated together and with input from business leaders and civic leaders and elected officials, you know, go forward. And so there are ways to do that. One of the things that we've been working on is contact tracing, which is an employment opportunity for folks, some of whom would come out of these communities, that can help set the pathway for future careers in public health. And the future of public health isn't going to simply be about trained scientists. It's going to be about community health workers and cultural brokers, the type of folks who, by intervening in the lives of folks, economically and socially, actually help to hold down illness and disease within communities. And that's true about COVID-19, as is about diabetes or heart disease or any of the other illnesses that we can have better control of if we had the right kind of healthcare system. And healthcare in the future isn't about healthcare going to the hospital. It's about health outside of the hospital walls that'll become more and more important as we go forward. And I just use health as an example because of my institutional relationship to that as well. But you could think about that in the same way with the small business sector. We've seen some of the problems with the federal plans, how 90% of women-owned and minority-owned businesses did not get to participate in the PPP program, right? The payroll protection program.
Right.
That's a structural inequity. And that's not any fault of their own, so we can't blame people because they weren't prepared or whatever. We know that if you want to have robust communities, that business sector has got to be invested in. That is a public safety issue. That is a health and wellness issue, because those type of investments have what we describe as spin-off effects. They affect more than just the business itself. It actually influences the thinking and the behavior of the folks who live close to those businesses as well. And we got to focus on dealing with the issues around homelessness and the unhoused, because we don't want the unhoused to be additional vectors for illness. If they contract it and they move about because they don't have housing, they can actually infect other people. And it's simply, and you've been a champion in this, Mr. Mayor, there is a moral responsibility that we have to the unhoused, who are not just unhoused, it's actually a safe way of saying it, but they are women, and they are children, and they are men, and they are Sacramentans. They are members of our community who deserve to be supported as well. And then we have our young people. And we talked about them a little bit earlier, but there is much more that we can do across those domains I just described. Because the likelihood is that a young person's first job will be at a small business in their community. So if we try to stitch these things together in ways that I think make sense from an investment standpoint, makes sense from a moral standpoint, that we're going to go to the communities that have been left behind, and we do it in a way that's both accountable and effective, allowing for those who have often been pushed out to build their capacity to be successful, then I really do believe we in Sacramento have a chance to build the city of the future, better than those folks on the coast who like to think they have everything, done well. But it can be affordable, it can be great for families, it can be inclusive, it can be the type of city this country needs to see prosper to prove that it in fact can be done.
It's the great answer. So one of the tricky parts of the federal stimulus is that the statute is very clear that the $89 million needs to be spent for impacts related to the coronavirus. And I think a relatively broad interpretation of that is intended. And I'm not asking you to give a legal interpretation here, but back to the question about how COVID has exacerbated some of the pre-existing issues and inequities in our community. I want you to touch a little bit more on that. What would be the connection between the impact of COVID from a broad perspective and what's happening, the actual impact in our diverse communities of Sacramento?
Well, we know that about 40% of American families couldn't survive an emergency bill of $400. So you can imagine what it must mean to many, many families across any race or ethnicity if you have your income decimated for 6 weeks and perhaps as long as 18 weeks, going forward. We're not exactly sure when we're going to be, out of the situation that we're currently in. And our hope is that it'll slowly improve, but it's probably not going to be that everyone's going back to work next week. So we know that the impacts from COVID are going to be deep and long-lasting scars that families are going to have to be dealing with for some time. And we should be preparing ourselves for that as best we can. I think some of the things I said earlier about making sure that families were secure in their nutrition is a COVID impact. The impact on food banks and the ability to actually acquire food at the rate that we need it in order to help struggling families has been pretty phenomenal. And I talked about our partnership with the city and of course with the Sacramento Food Bank in terms of our ability to actually meet some of the need. But I also said that we turned away cars. Now I was at one site, and Mr. Mayor, we're doing this at multiple sites. I'm pretty certain that was not just an experience I had last Saturday as well. I think the testing is something we talked about, and I know there may be separate funding for that, so we shouldn't look to be double dipping at all because we have, the need is so great out there. But we should clearly be thinking about employing some folks who actually can help do that contract tracing, because the ability to kind of get the virus spread under control is also part of the economic opportunity. Because the sooner we do that, the sooner we can get back to the new normal around economic operation and functioning as we allow society to once again congregate in ways that we can't do now. So I think that's an impact. The impact on education. And I can't understate this, because that a robust economy needs an educated workforce, right? And so we know that education has been impacted by COVID, particularly kids who don't have access to broadband or who may not have access to computers. Now, school districts have done and tried in amazing ways to meet those particular needs, but we both would probably agree that it is okay and insufficient at the same time. We have got to do a lot better than we've done. And then again, we've talked about business. Now, we've got to invest and get our small business is up and running. Part of our growth strategy here in Sacramento has been food, restaurants. And clearly, when you think about COVID and the impact, the ability to kind of gather and share food, and I don't care what ethnic or racial, history or you prescribe to, we know food is always the heart of gatherings of people and getting folks together. And even if it's a business meeting and those things are not part of it, food is important. We're the farm to fork capital of the world. We got to make sure our small businesses, particularly our ethnic restaurants, spread throughout the city, not just downtown. And I have nothing against downtown. Love showing up downtown and having a great hangout weekend with my wife. We do that quite often. But I also know when I head down on Stockton Boulevard and Mack Road and Freeport Boulevard that there are great restaurants down there as well that need help and could be part of whatever program we design, where those who can't cook might want to get a hot meal going forward. I know we've experimented some of that with some of the downtown restaurants, but an expansion of that for folks to get ethnically appropriate foods, things that they're used to eating, I think would be a few ideas of some great things we can do.
Stay tuned for a big announcement as early as tomorrow, maybe Wednesday or Thursday on that story. I want to conclude because, you and I both talk a lot about how to take a strategy and to actually implement it in a way that it is felt and that people have the confidence that you're going to back it up with even more. And so you mentioned this issue of contact tracing, and this is something you and I have been talking about in our respective leadership roles. We're on a call today. This, of course, is an essential part of reopening Sacramento, that we are increasing our testing capacity, working in collaboration between the county, UC Davis. We're now at about 1,000 tests a day. We believe we can get to about 2,000 tests a day. And that is not enough, but of course, it's not enough anywhere in the state or the country. But with the testing capacity that we are increasing, it has to be matched with this contact tracing project, where people literally are trained to ask whoever tests positive who they've been in contact with, and then to research, if you will, and talk to all of those people so that we can at least know whether or not those who are positive have potentially spread the virus. And this is a unique opportunity to actually test this employment training idea with people who are interested in health fields in a real way. So talk about that again. How can we use contact tracing here, working with our community colleges, working with your community foundation, the city and the county, to actually achieve multiple objectives at the same time?
Contact tracing is one of those things that goes to the question you asked. I know it was in some ways, provocative question and trying to get me to articulate, why this notion of doing well and doing good are not in some ways kind of separate areas of activity, and you really can bring them together well. You're right. The testing component is a requirement, but contact tracing, in order to do good by actually being able to contain the spread of the virus, and to do well by actually allowing economic activity to again ramp up, are part and parcel to a common strategy to actually get back to, to go forward in ways that allows us to begin to really work on the ideas that we've talked about earlier, inclusive economic development and so forth and so on. And clearly, this kind of health work, and I said this earlier, is the future of healthcare. For diabetes control, you use community health workers, right? You can cut the rate of diabetes in America, which is an epidemic. Over 76 million Americans actually have the illness. If you had community health workers who can work with folks so they would actually better manage their medication regimen or be more engaged in activity, right? And so we know in the world of health that this type of work is really important and can be really impactful in the treatment of illness by promoting wellness. Contract tracing can actually connect people to a new and growing sector of the health field, which really is around community health workers, because it is public health work using community folks and working community going forward. And so you can actually train people to actually engage in contact tracing in ways that allows you to deal not just with the spread of the illness, but the perception of the public as to when it's safe again to engage in economic activity. And let me just say this, it's interesting to me when I see folks talking about, oh, we just want to open the economy, just open things up. Most people I talk to aren't quite prepared to walk back into a movie theater unless they know the likelihood is they're not going to come out with an illness that has a high rate of morbidity to it. You couldn't end up in a hospital, but also a frightening rate of mortality to it, which means people actually lose their lives as well. So the perception of safety around economic activity is almost as important as the legal authority or privilege for conducting it. And we've got to bring those two things together. Contact tracing as both an employment pathway opportunity into it, to the new fields within the health sector, and it has that incredible opportunity to give, Sacramentans and average residents the confidence, go back out and engage in the things that we love to do, which is to be around people and to fulfill our lives through work, play, education, and so forth. So, I'm really hopeful that the conversations we're in, Mr. Mayor, you've been leading, bear fruit. The last thing I'll say about this is that, I learned a long time ago, the death of great ideas is bad implementation. And so we're looking forward to being part of a planning effort. I know you're going to have some staff assigned to this. I would project now that we're going to do an extraordinary job with the leaders that you've helped assemble around this. And we're going to showcase what it really means to do both, to do good and to do well by our communities at the same time. Sorry for the long answer, but
it was a great answer, and we have to do it in real time. Like, have a plan to stand up 300 plus contact tracers ready to be trained and ready to go over the next week to 10 days. And so, no hill is too big for us to climb here together.
Not at all.
Not at all.
The right level of commitment, I have found, just like our Donate to Sacramento, people with the right inspiration and leadership are capable of extraordinary things in service of one another.
Chet, I really want to thank you for your time tonight and for your passion, your compassion, your intellect, and your commitment. And we need to do everything we can to ensure that as we recover as an entire community, that we continue what we have started here And that is to make sure that inclusion is not just a fancy word, but actually has real meaning, where we invest our resources, where we pay our attention, and in our commitment to actually making sure we leave no one behind. And the work will never be done. But you're right, Sacramento can in fact be the state and the nation's model for how we intentionally go about making sure that every kid matters, every family is counted, and that we back up our rhetoric with real dollars, real resources, and the kind of innovative spirit that will actually bring results. And proud to partner with you, man, and we'll get at it again tomorrow.
Same here, Mr. Mayor. Thank you. It was great, honor to be welcomed into the broadcast, and looking forward to moving the work forward.
Good deal. Good night, everyone. Thank you. We'll talk to you again Wednesday and probably tomorrow in other media. Thank you.